Hi everyone, so today I'm going to be talking to you about genetic illnesses, and the population that I chose to discuss is those with cystic fibrosis. So cystic fibrosis is a disorder that affects a person's lungs and digestive system. Most people are tested for cystic fibrosis at birth, and most cases are diagnosed by the age of 2. Even though there are some adults that are diagnosed with cystic fibrosis, it's really rare and it's most commonly diagnosed in young-aged children. The average age a person lives with cystic fibrosis is 37 and a half. And cystic fibrosis is a genetic disorder and is often transmitted to an offspring by one parent. So the reason that this population is so different is because it's primarily children, and it's a primarily young population that we will be dealing with as social workers. The three challenges that people with cystic fibrosis face is that they're oftentimes admitted to the emergency department. Their insurance doesn't cover a lot of their services or medications, and they have financial and social barriers. So in a case study I read, a 14-year-old came into the emergency department with complications due to his cystic fibrosis. He was admitted to the emergency department, and because of that, he was unable to receive the service he needed right away. Also, because he needed extensive services, those weren't covered by his insurance. So these three challenges are the three things that people with cystic fibrosis face. What's happening is, with the insurance side of things, people with cystic fibrosis are not going to the treatments or not getting the medications they need because they know it's not covered by insurance, and they're unable to afford the cost or pay for the cost of the medications. So these three things are the big challenges. So as a social worker, how would I address these challenges? So first I need to see if there's any alternatives. Is there other medications or other services that I can provide with my client that their insurance will cover? I need to stay educated on the topic of cystic fibrosis, and I also need to stay up to date on insurance. Do you think if, insurance has changed, does new things get covered? Does things not get covered, and things like that? So I really need to stay up to date on both of those things. And I also need to see if treatment is possible while in the emergency department. So in another case study I read, a person came into the emergency department and they needed treatment for their cystic fibrosis right away. What they did was they brought in an LCSW who provided them with psychotherapy. So is this possible for my client? Can we bring somebody in that can provide them treatment in the emergency room at that time if it is necessary? So what resources do I need as a social worker? So I need to be educated on the insurance side of things. I need to know what these insurances cover, what they don't cover, what my client can get, what kind of medications they can get, and stuff like that. Because I need to be able to tell them and their families what is possible and what isn't. I need to be up to date on treatments. What do people with cystic fibrosis tend to get? What kind of treatments do they get? And then I also need to understand theories and interventions. I'm not only dealing with a client when you're most likely, because cystic fibrosis is most likely a younger population, I'm probably dealing with families as well. So I need to understand theories and interventions that not only work for the client, but I also need them to work for the family as well. So what resources does my client need? So they need to understand their healthcare and their insurance. What can they get? What kind of services can they get? What kind of medications can they get? They need to understand their treatments. So if they need a certain type of treatment or a certain type of service, I need to make sure that they understand what they are getting and how it is going to help them. I need to let them know if there are alternatives. What other options do they have? If they feel like they want to explore these options, how do we go about that? And finally, I also think what's really important is giving them information on support groups and where to go. Since when you're dealing with cystic fibrosis, you're dealing with it through a lifetime, and sometimes that can get hard. So by going to a support group, you're able to talk to other people that are going through the same things. You can support one another, be there for one another, and listen and talk to and just talk about how you're feeling and the emotions that you may be having due to your cystic fibrosis. So I feel like these four things are really important to give to your client. So what skills do I bring to the table that maybe some of my team members don't? So first, I'm not only supporting the client, but I'm supporting the family as well. Like I said, when you're dealing with young population, you're also dealing with families. So it's important for me to not only support the client, but I'm supporting the family and making sure that everyone's on the same page. I'm sending the client and the family home with a safety plan. I'm making sure that when they leave, they are able to care for my client and provide them and get them to, if they need to get to services, they're able to get them there. If they need to get the medications, they're able to get them, and they just understand how they need to go about things. Next, I'm able to provide a psychosocial assessment. So when you're dealing with cystic fibrosis and you're dealing with it through a lifetime, people can often struggle with their mental health. They can struggle mentally, emotionally, and physically. So by doing a psychosocial assessment, I can see if my client needs something to support their mental health. Maybe they are suffering from depression or anxiety due to cystic fibrosis. If that's the case, then I can provide them with other services and other treatments that can specifically help their mental health. And then also, I can make sure they're understanding their treatments and how they can go about getting referrals. And basically, all this ties into communication skills, making sure I'm communicating well with the client and their family, making sure that I'm giving them all of the information they need before they walk out the door, that they're comfortable and confident enough to leave and provide the care that they need, that the family can care for the client and the client is also able to do stuff on their own and understand everything. So basically, by making sure I'm communicating well with everybody, we can make sure that the client goes home safely and is taken care of. So lastly, I want to talk about the 2 questions I asked in the discussion board last week and what my peers said. So the first question I asked was, what services do you think should be openly available for those who suffer from psychiatric or genetic illnesses? So my peers said that they feel that people with cystic fibrosis should be able to have universal health care, and I completely agree. A lot of times, the medications and the services that people with cystic fibrosis need aren't covered. So by having universal health care, they don't have to worry about the treatments or medications being covered. They just know they are, and that's a big weight lifted off of their shoulders. They know that they can have what they need to survive, and I feel like it's really important. And that's what she said as well. How do you think social workers can overcome the barriers they may face in these situations? So what my peer said was that they feel that as social workers, we should have resources that we can call upon when we're faced with situations like this, which I think is a really good point. As social workers, we have a lot of information we need to retain, and sometimes we can forget things, and it's good to have kind of something that we can go back on to say, oh yeah, this is how I can deal with this situation, or this is how I can help my client in this way. So I think that's really important. I think it's a really good point. So with these 2 questions, I think my peers answered them exactly how I would, and how I think that these 2 things are really important for social workers when they're dealing with people with cystic fibrosis. So I want to thank you all for watching. I hope that you learned more about patients with cystic fibrosis and how you as a social worker would have to deal with people, a client with cystic fibrosis. So I hope you all enjoyed, and thanks.